Hi, everybody. We're so honored to participate to this symposium. Thanks a lot for the invitation and congratulations for the organization of this virtual session in spite of the hard circumstances. We would like to thank particularly Jonathan Green and Catherine Aldred, who helped us so much to make PACT known in our so-called Occitanie region and in France in general. I let Ann-Laure begin the presentation.
Thank you, Thierry. As you can see on the slide, we will present the dissemination of PACT in France since 2017. In February 2017, Catherine was invited by Marie-Maud Geoffrey to do a PACT training in Lyon. We were 20 professionals in autism from different places in France. All of us were enthusiastic to discover this new approach, which was bridging many concepts and skills. We therefore identified 4 of us to become certified and then to become trainers in order to implement PACT in France. In 2018, 3 trainings took place, one in English with Catherine in Montpellier, the second one both in English and French with French and English trainer, and the third one in French in November in Toulouse. In 2019, 6 others were scheduled. One in English with Catherine in Toulouse, 2 both in English and French with English and French trainers in Lyon and Versailles, and 3 only in French in Toulouse, Montpellier, and Bordeaux. Each time there was a very positive feedback. PACT brings a support to parents and professionals, and this was missing before. In 2020, we planned 6 other trainings in French before the COVID crisis. Unfortunately, only 1 could take place. But don't worry, the other 5 will be rescheduled as soon as possible when the crisis is over, or online when impossible to meet together. On the next slide, you can see the 4 trainers in France. There is 1 trainer allocated to develop PACT and to run the PACT trainings for each quarter of France. Marie-Joëlle Aurève for the Northwest, Lucie Janssen for the Northeast, Natacha Galifet for the Southeast, and Marseille for the Southwest. Most of the time, we run the training courses in pairs, with a speech therapist together with a child psychiatrist, because we find it very interesting to have a multidisciplinary approach to run the training for the students. We work a lot together to keep on learning from each other, watching PACT videos, certifications, working on the French translations. Since 2017, 249 professionals have been trained in France. 100 more were planned before COVID crisis. As you can see, the professional trained at PACT are spread throughout the country. The next training sessions will take place in Lyon, Versailles, Strasbourg, Montpellier. And last but not least, on the next slide, you can see 2 great motivating projects. Firstly, the translation in French of the PACT manual is now finished, and Aubrey will edit it soon. The estimated date is around December 2020. This was a big piece of work and a great team achievement from the French team trainers. Secondly, the IFPAT study will start soon. This is a very interesting multi-center study led by Marie-Maud Geoffrey in Lyon, and the aim is to test the efficacy of PACT by video conferencing. And in the current period, this may reveal quite useful. And now, I would like to hand over to Thierry, who will detail the situation in the Southwest.
Thank you, Ann-Laure. So let us focus on the southwest of France, where we come from. The area is large and concerns about 5 million people. There are 3 large cities where the PACT training sessions were organized: Toulouse, which is ours, Bordeaux, and Montpellier. 2 administrative regions form the area: Occitanie and Nouvelle-Aquitaine. On this slide, you can see that 189 professionals have been trained for PACT by French trainers during the last 3 years. The map shows the number of trainees in each district of the area. These numbers were made possible because of grants that we received from regional public health agencies. Attendance came mostly from pluridisciplinary pediatrics and psychiatric public health French system teams of the different districts and didn't have to pay to participate. Very few have a private practice. The next slide shows how diverse was the profile of the trained professionals: psychologists, educators, psychiatrists, and speech therapists were the most numerous among them. As the next slide explains, there's a gap between the number of trained professionals and the number of those who are engaged in certification. Actually, only 17 of those who attended training sessions are certified or should be certified soon. Nurses seem to be more motivated than other categories, which are all represented amongst certified. On the next slide, you can see that about 50% of the certified professionals practice in the southwest of France, and Ann-Laure and I are really proud of that, even if that concerns only 16 people. Nevertheless, you may wonder why certification seems to be difficult in France. PACT training has always made people enthusiastic, but certification appears somewhat as a constraint, and French people doesn't like constraint. We know many trainees are practicing PACT without any control, and we think it's a success anyway, because PACT wins notoriety, even if there's no benefit for research. Some trainees complain about time issues to justify they don't practice. On the other hand, we think that the fact that training was free of charge for trainees or their employers was not a so good idea, because nobody was obliged. As a conclusion, I would say that we've accomplished a first phase of implementation of PACT in France, which aimed at making the therapy be known by a large number of professionals and their teams. We have now more candidates for the next announced training sessions than seats. We should select the most motivated and engaged ones. We need also to search the support of organizations of parents we have not enough mobilized. So a lot of work is coming concerning the implementation of PACT in France, but we are really convinced that PACT is worth of it. Thank you for listening.